morning, everyone. Welcome to Easy Nurse. So let's start our today's session of Easy Dose. The first we will be discussing in this session regarding the nursing foundation, which is applicable for the BSc nursing students, for post-basic BSc nursing students, and also for the GNM students. So, whatever we are discussing in this session is applicable for all these courses. So, today we are going to discuss regarding the first chapter of our nursing foundation, that is Introduction to Nursing. So, let's wait for 2 minutes for all of our students to join the live class. So, let's start with our first chapter, that is the Nursing Foundation and Introduction to Nursing. Our first topic is the concepts of nursing. So under the concepts, there are 4 important concepts that we'll have to keep in the mind. The first concept is our health concept. So under our health concept, we are focusing on the promotion of well-being of a patient. So our main point is we are promoting the health of the patient. We are focusing on promotion of the health of the patient. How? By making sure the illness is being reduced, or we are preventing the sickness. We are also delivering the patient-centered care, making sure the comprehensive care is given to the patient. The overall care we are giving to the patient, keeping the patient in our main aspect and giving the care, and also improving the physical, mental and social well-being of the patient. So this clarifies us regarding the health concept of our nursing. Hope so you people are understanding. If any questions, please link on towards our box where we can ask for the questions. At the end of the session, we are going to answer all your questions. So the second concept is the nursing concept. Here, it is based on the compassionate care of the patient. So we are giving the care to the patient, wherein which we are making sure we are giving a comprehensive and a compassionate care. So we are making sure the all over or whole concept is made sure is we are giving the care to the patient on the all aspects, not only the physical care, but also we are covering the concept of mental issues or any other kind of issues the patient is having. We are taking care of that aspect. So here we are focusing on the patient advocacy. We are standing on behalf of the patient and making sure the rights of the patients are covered. So we are advocating, you're standing behind the patient, and we are discussing regarding the patient's rights as well. Next is the holistic support. So overall care, not only the physical but also the mental, social, economical status, all this kind of issues also we are discussing. And next is promoting the health. So we are increasing or we are improving the health of the patient. We are managing the sickness and improving the overall quality of the life of the patient. This is the nursing concept of our nursing. The third concept is the person concept. Here, the nursing is defined as providing the persons with comprehensive care and support. As we already have discussed, comprehensive all over care we are giving to the patient and encouraging the health and well-being via the physical, emotional as well as the psychological aid. We are giving physical help, psychological, and also we are giving the emotional help or aid to the patient. And coming to our fourth concept is the environmental concept. It is comprising of the internal and external factors. It may be the internal factors which is related to the body, the external factors, maybe the environment, maybe how your environment is influencing your health. Internal and also the external factors, how it is influencing your health. So these are the 4 important concepts of nursing. That is nothing but the health, nursing concept, person and environmental concepts. So let's move on to our next important topic, that is the definition of nursing. As we all know, there are a number of definitions in nursing, but we have chosen the most important ones that may arise for your upcoming exams. The first one is given by the Virginia Henderson in the year 1960. The definition goes as, it is the unique function of the nurse wherein which it is assisting the individual. We are helping the individual who is sick or well. So he may be sick or he is recovering from his disease. So for those people, we are aiding or we are giving the health care, wherein which it is performance of those activities we are contributing to the health. So we are improving the health of the patient or to his recovery, and in some emergency cases to a peaceful death as well. We are making sure the pain in the person is being reduced and he is leading to the peaceful death. So in these areas or in these aspects, we are improving the health of the patient, wherein which we are performing those activities without any help, unaided, where the nurse, as a nurse, we should have the necessary strength, the will, and also the knowledge regarding giving the care. So this is the definition of nursing according to Virginia Henderson in the year 1960. Coming to our second important definition, it was given by American Nurses Association in the year 1980. So the definition goes as, it is the integral part of the healthcare system where it is encompassing, which is, it is enclosing promotion of the health. The first aspect is promoting the health of the patient. The second is preventing the illness, as already discussed in our prior definition. Next is giving the care through the physically ill. Whoever is physically ill, we are giving the care to those patients. Mentally ill, and also who is disabled people, who is not having or who is having disability maybe in the hand or the leg. So for those people also we are giving the care. The physical ill people, the mentally ill people, and also for the disabled people in all the ages, maybe it is young child or older adults, we are giving them the care. For people of all the ages, we are giving the care in all the health care and also other community settings. So any healthcare settings, we can give the care to the patient, and also in any community settings, we are giving the health care to the patient. So this is the second definition of nursing given by American Nurses Association in the year 1980. So further, let's move on to our next important topic, that is the functions of nursing. There are several functions of our nurses. So we have listed down all the important ones. Coming to the first function is a caregiver. So the main and important role of a nurse is to give care to the patient. So as all of us as nurses, we know our responsibility is giving the comprehensive care to the patient. That is the first function. Coming to the second one is a communicator. Obviously, as nurses, we are going to communicate with the other healthcare team members in order to give the care to the patient. We are communicating with the patients, we are communicating with the patient family members, and also to the other people who is related to the patient. We are communicating with them in order to understand the condition of the patient and give a comprehensive care. Coming to the third is the teacher. So here we are trying to teach the patients or the family members regarding the condition of the patient. So we are trying to give them certain kind of education regarding the condition of our patient. The next function is the client advocacy or the client advocate. We stand on behalf of the patient in order to make sure the rights of the patients are upheld. So the rights of the patient should be upheld when we are giving the care to the patient. So we stand on behalf of patient and we make sure their rights are fulfilled. The next function is the educator. As already discussed, here the teacher and the educator, the function is similar. We are trying to give the knowledge regarding the patient's condition either to the family members or the patients. Further, the next function is the counselor. So, in certain conditions, if the patient is under depression or in any related to the psychological disorders, we as nurses can counsel the patient, can speak to the patient regarding their condition, what are the symptoms they may have. So we are trying to communicate with them certain sessions of counseling which helps them to relieve from their disease conditions. The next function is collaborator. In the sense, we are collaborating, we are communicating with many of the other healthcare team members. For example, we are communicating with the doctors, we are communicating with other department nurses, etc., in order to give a complete care, wherein which it is improving the health condition of that particular patient. The further function is research. Obviously, as nurses, we have to update, as we are nurses, we have to update our knowledge every day and then in order to treat the upcoming new disease conditions. So we have to do our own research regarding the upcoming disease conditions. So we should act as a researcher. That is also one of our main function. Coming to the next is a manager role. So here we are coordinating not only with the doctors but also the other departments which is related to the patient, and then we are managing our work. As we are the nurses, we have to do all these functions at the similar time. And the final is regarding the leadership. So we as nurses, we take up leadership in any of the emergency conditions regarding the knowledge that we have gained about the disease condition of the patient, and we move forward to give the care in any of these emergency conditions. So we have a comment about one of the student. So anybody is having any doubts regarding the session, please comment in our comment box so that we can answer. Hi students, for all of your comments we are going to answer at the end of this session, and if in case you're having any doubts of this session, please comment in our comment box. So at the end of the session we're going to clear all your doubts. So let's move on to our next important topic, that is the qualities of the nursing professional. So any person who is doing nursing, they have to have certain important qualities. So in our nursing profession, these are the important qualities as nurses we should have in ourselves. The first one is love for the fellow men. Nothing but anybody who's working along with you or the co-workers, you should have certain kind of respect and coordination along with the fellow people whom you're working with. So that is the first quality as a nurse we should have in ourselves, that is love for the fellow men. The second one is honesty and loyalty. We should be very honest towards our work and loyal towards any procedures we are performing on the patient. That is your second important quality. The next one is discipline and obedience. If you do not maintain discipline, especially in the nursing profession, then it will not be useful when you're giving care to the patient. So make sure as nurses you learn discipline in your life and be obedient towards your seniors and also to your juniors. So the next quality is dependability and adjustability. So here we need to depend on our seniors in any of the important procedures. If in case you know certain procedures that you're performing and you're very confident in that, you don't need to depend on those kind or on this situations. So also regarding the adjustability, in certain conditions you as a nurse, you will have to adjust during the time period, or if you're in the first day or first shift. So sometimes the shift may extend. So adjustability and dependability are the qualities that a nursing professional should adapt themselves in themselves. So the next quality is ability to inspire the confidence. When your juniors come down, when they are entering your hospital, or you as a seniors, you're teaching them certain procedures. So at that point of time, your procedures or the way you're giving the care should inspire your juniors. They should learn so many things from you, as you should be a model nurse for them. So that ability also you should have. The next point is the economy of time, material and energy. So this quality is very important in every nurse. So anybody who becomes the nurse should have this quality. This is nothing but economy of time. So whatever time you're taking in doing any procedure, or whatever materials you're using, and also the energy that you're wasting in doing any of the procedure to the patient should be legible, should also be accountable. So you should be responsible for it. It should be useful. All this economy of time, the time that you're spending, the materials that you're using, and also the energy that you're spending should be useful for the patient. And the further is sympathy and empathy. So you should have concern towards the patient. You should show sympathy towards the patient when you're giving the care, and also empathy. The main difference is empathy is nothing but you're standing in the patient's situation, you're experiencing the situation of the patient. You're standing in their place and experiencing the pain, the discomfort that they are having. So both these qualities are important as nurses. The next one is the intelligence and common sense. In certain emergency situation, you as nurses should show your intelligence. If any patient is coming out of a cardiac arrest, the first intelligent nurse, what she will be doing is they will try to give CPR. So if there is no breath coming out, making sure that is the intelligence that you're showing in that emergency situation as a very intelligent nurse. And also certain common sense you should use when you're giving the care to the patient. So these qualities you need to adapt when you come to the nursing profession. The further is patience and sense of humor. Patience is one of the most important, especially regarding if you're coming to any of the healthcare delivery, or when you're giving healthcare to the patients, patience is very important. Further, the good physical and mental health. If you as nurses, you do not have a good physical and mental health, you'll not be able to give care to the upcoming patient as well. So, maintaining a good physical and mental health is also being very important quality as a nurse. And the last important quality is gentleness and quietness, not shouting on the patient. So gentleness, when you're giving a care, when you're communicating with the patient, gentleness and quiet listening should be there as a nurses. First, you try to listen the problems that the patients are having as a nurse. Yes, so that is the main quality. So these are the important qualities that a nurse should adapt in her life if she is moving to a nursing profession. Hope so you people are understanding the class, and any doubts please comment in our comment box. The next important topic is ethical principles. There are certain principles or rules that is being formed for the nurses in order to perform the nursing practice. The first important ethical principle is accountability. As we already discussed, accountability is nothing but whatever procedure or whatever function you are doing or whatever care you are giving to the patient, you should be responsible for it. If in case you are doing something right, you are accountable for it. Yes, I am responsible for the care that I am giving. Maybe unknowingly you have done something wrong. Try to accept that wrong what you have done. So that is called as accountability. Coming to the second one is reasonability. So why is this procedure done in these steps? So what are the problems that they are experiencing? So this reasonability should be there as the nurses. The third one is confidentiality. So if there is any secret information the patient has shared, so we as nurses, we should keep it confidential. We should not share it with the third person until and unless it is for the benefit of the patient. So any secret information of the patient should never be shared to the third party. So that is only called as confidentiality. The next ethical principle is autonomy. Autonomy in the sense we are having the right to make sure whatever decision we are doing. So if in case the patient needs the care, then we can give the care. If they are saying yes for the care that we are giving, then only we are able to give the care. If in case the patient is denying the care, then we are not supposed to give that care. So they are having the right to accept or deny the care. So that is only called as autonomy. The next ethical principle is non-malfeasance, in the sense we should not do harm to the patient. So any procedure that we are performing, we should never do harm to the patient. It should not harm the patient. The next is beneficence. Beneficence in the sense we should always do good to the patient. In the sense we need to improve the condition of the patient rather than making sure the patient is losing his health condition. The next is justice. We should always be equal to all the patients. Not just that because they are fair or because they are dark, we are giving good care to them. So making sure justice is maintained to all the people who is receiving the care. Be truthful when you're giving the care. The next is fidelity. What do we mean by fidelity? Anybody who can answer, you can just comment in the comment box. It is nothing but being faithful to any of the agreements, or if I have been approving or agreeing, so certain agreements we have made. So we have to be truthful or faithful to our promises that we have made. So that is only called as fidelity. So we have to be making sure we are faithful to any of the agreements or to the promises that we have made. And finally, veracity. What do we mean by veracity? It is nothing but it is the telling of the truth or being truthful to the patient. So these are the important ethical principles that as nurses we should perform, or we are made sure we are going to follow all these ethical principles when we are giving the nursing care. And the next topic is the INC code for the professional conduct. As we already know, these are also certain principles or certain rules that our International Council of Nurses has given to the nursing professionals that we as nurses should follow. The first, INC code for the professional conduct is professional responsibility and accountability. So as nurses, our professional responsibility is giving care to the patient. Yes or no? So yes, the main responsibility as nurses we are having is giving care to the patient, and also we are accountable for any care that we have given. So all of you can see that everybody who is going to the hospital as nurses, we are going to account, or we are going to write down whatever procedures we are doing. So we are accountable. We should be accountable in the sense we are responsible for any of the action or procedures that we are performing on the patient. The second one is nursing practice. So here we are maintaining certain standards that has been given, and we are performing the nursing care to the patient. So according to the standards of the nursing care, we are giving the care to the patient under the nursing practice. The third one is communication and interpersonal relationship. So if as nurses we are not communicating with the patient or the family members, we will not be able to understand the condition of the patient, and we will not be able to give good care to the patient. Yes or no? Yes, exactly. When if we are not communicating or not maintaining the interpersonal relationship with the patient, we will not be able to understand exactly what is the problem of the patient and give a good care to the patient. So that is very important. So this kind of code is very important. So communication and interpersonal relationship is very important as nurses, that we need to adapt in ourselves. The next one is valuing the human beings, respecting all the human beings as the same, and giving the care depending on respecting their values. Maybe there are so many cultural people who are coming in the hospital. It may be any different cultural people who are coming and admitting in the hospital. We need to value their we need to value their culture. We need to value them as a normal human being, treat them equally, and give the care. And the next one is management. So we need to manage multiple works. As nurses, we are having different amount or different types of works. We need to manage it in a proper manner, not making sure we are doing the nursing care properly, we are not doing the documentation properly. So all this kind of work should be managed equally. Documentation also should be done, managing the patients, communicating with their family members, communicating with the co-workers, and also we are making sure we are accountable for all the work or procedures that we have done related to the patient. And finally, the professional advancement. So we have to undergo continuous education, or we need to go on continuous research which improves our knowledge as healthcare professionals, and also we are improving the nursing practice. So continuously you should be under the study, in the sense you need to refer many books. Even though if you are working in the hospital as nurses, you need to perform, or you need to update your knowledge. So these are the important ICN code for professional conduct. So I hope you people understood until this topics. Let's move on to the next topic, that is the elements of the code. There are certain elements under the code. There are 4 important elements under the code. The first one is the nurses and the profession. So here we are determining and implementing all the acceptable standards in our clinical practice or in our nursing practice, and we are making sure required research is done when we are giving the care, and also we are making sure the standards are maintained. The nursing standards or the nursing professional standards are maintained as nurses, and we are giving the care. The second element is the nurses and the co-workers. So already we have discussed regarding the co-workers. So how as nurses we need to cooperate or coordinate with our healthcare team members and also with the family members of the patient himself, or any relatives of the family members or the patients. We need to coordinate. We need to make sure we are working together for the improvement or the betterment of the patient. The third one is the nurses and the practice. So what do we mean by nurses and practice? Here we are carrying the personal responsibility. As a person, as a nurse, we have our own responsibilities and we are accountable to all the responsibilities or all the work that we have given for the nursing practice. So we have certain rules and regulations, we are following the standards and we are giving the care to the patient. So next one is the nurses and the people. The final element is nothing but the nurses and the people. We are giving care to the people who are usually receiving the nursing care. They should be comfortable with the care that we are giving. So if the patient, as a patient is coming and admitting in the hospital, if he is not comfortable with the care that we are giving, we are not successful in our responsibility. So making sure the patient is comfortable by the care that we are giving. So that is regarding the nurse and the people. So these are the 4 elements of the code that we have to keep in the mind when we are giving the care to the patient. Hope so you people have understood until this topic. So any of the comments that further we can see regarding any questions you're having, please comment in the comment box so that we can resolve your questions. So we have certain discounts in our EasyNurse app. You can please log into the EasyNurse app through App Store or Play Store. Download the app and you can further discuss, or you are having so many information that is there in our EasyNurse app. As we have seen, you can also communicate or you can also refer to the given number for further information. And the MCQ questions, we have uploaded certain MCQ questions regarding the topic that I have taken today. It is present in our Telegram page. The link will be present below on the comment box. You can go and refer for the MCQ questions related to this topics. So let's read certain comments that we have got or certain questions that we have got. Can you please share some important questions related to the Nursing Foundation in the next session? Surely, as we have already told, we have certain questions related to this topic. The important questions will be updated in our Telegram page. The link we will be providing in our comment box. So we have certain comments and they are happy with this class. Any questions, please put you can ask in our comment box so that we can clear your questions. So that's it for today's class. Tomorrow's live session will be taken on the topic of biochemistry. Please log in at 6 p.m. and enjoy your class. Thank you.